Hello and welcome to CD 2200. My name is Alicia Saavedra and I am going to be guest speaking with you today and sharing a little bit about how I use my child development knowledge as a certified child life specialist. So before I start talking about what a child life specialist is, I'd like to tell you a little bit more about myself. I'm a certified child life specialist and have been since November of 2000. Prior to that, I was a child life assistant in the hematology oncology playroom at Loma Linda University Children's Hospital. Most of the experience that I have had in my career is in pediatric hematology oncology, our acute care area, which is general pediatrics, and also the day surgery unit. My undergrad degree is in child development with a concentration in child life. And my graduate degree is a master's in psychology with the child development track, which I actually got here at Cal State San Bernardino. Currently, I'm a full-time professor at Loma Linda University, and I'm also the clinical director for the Master's in Child Life Specialist program here at the university. My job is to oversee the practicum and internship placements of our students and to be a liaison between our academic program and the clinical programs. One of the things that I'm most excited about is recently I have been elected as the president-elect for the Association of the Child Life Professionals. Our association is a North American organization which represents the child life specialists that are in the United States and Canada, and we also have international members as well. While our international members are smaller in numbers, we still partner with them and provide resources and information that are up to date with our field. You can see my contact information there below. After this lecture, if you have further questions, are curious about what it's like to work with children in the hospital setting or during a healthcare type of crisis or a community-based setting, please feel free to reach out and I'd be happy to help you. Okay, so as we get started, we're going to actually begin with a visualization exercise. I'm going to give you some prompts and I want you to try to hang with me and just follow along, and then we're going to do some reflection afterwards. Okay, so I want you to think about what is the earliest age that you can remember yourself being when you were younger. Sometimes it's 5, sometimes it's 6 or 7, early school age, maybe even you remember people telling you stories of when you were in preschool, but what is the actual earliest memory that you have and what your age was at that time? Now think about what were some of the things that you liked to do at that time. Some of maybe your interests, your likes, maybe some of even your dislikes. What was your personality like, your temperament? Who were some of the adults or the caregivers that were in your life at that time? Just get a sense for who you were at that age and stage in your life. Now, think about at that stage and age in your life, we're going to introduce a crisis. Okay, and this may have occurred for you, this may not have occurred for you, this is all a hypothetical situation, but let's say, again, remembering who you are, your personality, your temperament, your development at that time that you can remember, let's say that you remember getting in the car and your caregivers, whoever those people were, drove you somewhere. You didn't know where you were going or what was going on, but you do remember feeling not well in your body. And that could be pain, that could be a stomach ache, that could be a fever, whatever symptoms you want to imagine yourself experiencing at that time. And let's say that you drive to this new place you've never seen before, and your caregiver stops the car and has you get out of the car and go with them into this big building. Okay, this is a tall building, lots of windows, these big doors open, you hear lots of different noises, some beeping sounds, you hear people talking, it starts to feel sometimes kind of loud and overstimulating. And then that caregiver of yours walks you over to some people that look like they work at this place. They have name tags on, but they're all adults. and they walk you to this place and they start touching your body and they start telling your caregiver different things, asking them different questions, but they start touching your body to check your chest, to look at your arms, they touch your legs, but nobody's talking to you, okay? Nobody's telling you what's going on, but you start to get some feelings inside. So just pause really quick. Again, at that age and that stage, what do you think you'd be feeling? Okay, how does that feel? What's the intensity of those feelings? So as that experience continues to happen, you start feeling different sensations from the different people that are around you, in the sense that maybe you feel the pinch or a poke on your hand. Maybe you feel a tight squeeze around your arm and you don't know exactly why that's happening. Maybe you are put into a bed that has some wheels and starts moving away from your caregiver, and you can't no longer see your caregiver. They're out of your sight. Okay. Maybe you're in a cold room. Maybe you are coming back to the place where your caregiver is at, and you're not understanding why you were separated from them. Okay. This is what it's like to come into the hospital. This is what it's like to maybe go to an emergency room or an urgent care. And this is a very common experience that children have when they go into the hospital, maybe for a healthcare crisis, for an accident, for some type of injury or illness. And so again, this is a very common experience that children, infants, children, youth, young adults experience when they come into the healthcare setting. So we're going to pause here and do some reflection in just a second. Okay, so welcome back. What's coming up for you? What kind of emotions maybe came up as you were doing that visualization exercise? Identify those emotions, name them. What intensity were they? A lot of times kids don't know the names of emotions. They know that they have lots of sensations that they're feeling in their body. Sometimes they're strong, but they don't necessarily know how to label those things. Not until the adults in their lives start to help them identify and label those. Do they really know how they're feeling and what feelings actually are. And now thinking back again to that age and stage, not necessarily the scenario we walked through, but just in general, if there was a crisis or something that was happening around you, did the adults in your life tell you what was going on? Did they communicate a lot with you about what's going on? What types of boundaries did you guys have about communicating crisis or big events in your life? And when those events were happening, were you curious? Were you confused? Did you understand what was going on in those experiences? And if you were aware of what was happening, did you hear big words, big what we would call adult words, things that maybe you didn't understand because at your developmental level, those were really complicated words to understand and completely get a sense for what was happening. So sometimes what happens when that occurs is that kids will fill in the blanks, right? They're kind of like, you know, the cracks that don't get filled, we'll fill them in with extra information. Sometimes those are assumptions, those are imaginary endings to a particular scenario or story. And that's where sometimes information can get really confused, and that's where stress can also increase because we don't have all the information about what's going on. Child life specialists provide a wide variety of services and interventions. As you can see from the list below, we do everything from medical play to behavior management to grief support, sibling support, and even community work. When a child comes into the hospital, it can be a really stressful experience. Oftentimes, this is the first time they've ever been back since they were born. And if they have a chronic illness, that means that we call them frequent flyers. They come back really often. So families and caregivers are often not prepared to navigate the healthcare setting nor the healthcare system. And this is where we come in. As part of the multidisciplinary team, we're there to help support patients and their families as they're entering into these new experiences. It can be stressful and scary, and it's helpful to have someone who can kind of coach you and help navigate the system with you. We work really closely with the social workers, our nurses, our doctors, our rehab therapies like speech and OT and physical therapy, and all the other people that contribute to that child's care. We want to ensure that we can try to minimize the stress impacts that they're experiencing by coming into the hospital. It's vital for child life specialists to have a good understanding of developmental theory as well as play techniques. We use these on a daily basis as we're interacting with patients and their families, and it also helps us to tailor the interventions that we're providing to ensure that we are meeting the children's needs where they're at that time and throughout the rest of their hospital stay. Sometimes when children experience an illness or have an injury, their developmental level is impacted. For example, if a child was typically developing and then had a traumatic accident, they may not be typically developing after that accident. If they had a brain injury, if they injured one of their limbs, for example, one of their legs, they may not be able to physically move around like they did before. And maybe their brain injury impacted their cognitive awareness and processing. These are the type of developmental impacts that child life specialists look for and assess when they're providing their services. Child life specialists are not found in all healthcare settings. Most of the time, you will find a child life specialist or a child life department if you are at a large children's hospital, in some community hospitals, and in some adult hospitals that have pediatric units. Listed here are some typical inpatient units that a child life specialist will cover, as well as some outpatient areas. An area of growth is our community-based settings. Many child life specialists have chosen to go into private practice. They work in the school system, providing disaster relief as county social workers, providing in-home assessments and connecting children to services, as well as working with children who are on hospice and receiving palliative care. As mentioned in the previous slide, child life specialists work in lots of different areas within the hospital, in the outpatient areas, and also in the community. In order to become a child life specialist, we must be trained to work with children who are infants all the way through teens and young adults, as well as the adults and caregivers that are in their lives. Click on the links below to see child life specialists in action. Here you can see the different areas and ways that child life specialists use their skills in child development, play, and providing psychosocial support to children who have been impacted by illness and injury. On the right-hand side, you will see an overview of what the qualifications are to become a child life specialist. Primarily, we have to complete specific coursework in 10 content areas. In the next slide, I'll have an expanded explanation of that. In addition to coursework, we have 600 hours of a clinical internship, which is in a hospital supervised by a certified child life specialist. After completing the coursework and clinical internship, candidates must complete an eligibility assessment verifying the completion of that coursework and internship, and then they will become eligible to sit for the certification exam via the Association of Child Life Professionals. Once that exam is passed, then a certified child life specialist must complete 60 professional development hours every 5 years. And that can come from conferences, seminars, and various trainings that qualify for professional development hours. There are two primary pathways that aspiring professionals take to enter the field of child life. Option 1 is to graduate from an Association of Child Life Professionals endorsed child life academic program. Click on the link there below to see a list of endorsed programs. Option 2 is to take 10 college courses in the following content areas. Those content courses can come from varying degrees, child development, psychology, sociology, and the like, but the requirements are pretty specific and the primary focus of the courses have to be in those particular content areas. Click the link below to read more about the academic eligibility requirements and the specific course criteria that are required for child life specialists to complete. Many who are going into the child life field are strongly encouraged to volunteer or get experience with well and typically developing children, as well as those who are experiencing stress or crisis in the healthcare setting. One of the experiences that most child life specialists have are doing a child life practicum, which is an introductory experience that allows those who are interested in child life to observe a child life specialist and understand the roles and responsibilities of a child life specialist in the hospital setting. While this is not a requirement for professional certification, many programs do ask for a child life practicum or 100 to 120 hours of volunteer work in the healthcare setting working with children. In addition to these foundational experiences, aspiring professionals must complete a 600-hour clinical internship under the supervision of a certified child life specialist. For more information about the criteria that is required during a child life internship and to sit for certification exam, please click on the link below. Thank you all for spending some time with me today and learning a little bit more about what child life specialists do and how they utilize their child development knowledge in working with children and families in healthcare crisis. For more information, click on the links here to learn about the Association of Child Life Professionals and the certification requirements, Loma Linda University, where I am at, and our Child Life Specialist program, and also the Children's Hospital here in Loma Linda. There are volunteer opportunities that are available for those who are interested in getting exposure to working with children in the hospital and in our playroom areas. Thank you again, and good luck in your career pursuits.